Namaskar. So many patients who comes to me with a pain often ask me, Doctor, do I need a knee replacement surgery? So there is lot of fear among the patients regarding the knee replacement. So in next few minutes, I am going to tell you when you to get knee replacement and when not to. First, knee pain automatically doesn't mean you require a knee replacement. There are a lot of causes of knee pain. Initially, it could be because of your old injury. It could be your ligament sprain, or it could be an initial meniscus injury, or it could be a pain arising from your hip and knee. So before considering about knee replacement, you first evaluate why your knee is hurting. So when you should seriously consider for knee replacement, there are the 5 important signs which I am going to tell you regarding when to consider knee replacement. First, when there is a persistent pain in your knee, when you are unable to walk freely, there is a difficulty in climbing staircase, difficulty to get up from your sitting position, or when your walking distance has been reduced. Secondly, when the patient's daily routine activity has been drastically reduced. Thirdly, when the patient has tried all the forms of non-operative treatment modality in the form of physiotherapy, weight reduction, some anti-inflammatory medication, some supplements, and some form of injection. Despite of all these things, the pain is not subsiding. Fourthly, if you are observing the deformity in your knee in the form of bowing or knocking of the knee, it depicts the severity is increasing. And fifthly, on getting the X-ray, when you see there is an advanced stage arthritis with bone-on-bone contact, and there is a reduction in the joint space. So when you have all these 5 factors, then you should consider for the knee replacement surgery, because post-operative, the patient will get a better functional alignment and he will have better mobility. Arthritis depends upon mild, moderate, or severe. So in early stage arthritis in the form of mild or moderate, which can be managed conservatively in the form of a medication, some anti-inflammatory medication, some supplements, some injections or weight reduction, and physiotherapy. So always it doesn't mean that arthritic patient need a knee replacement. You need to evaluate your stage of arthritis and need to treat accordingly. Fourth, many patients ask me about the age. They ask me, Doctor, I am 55-year-old. Do I need a knee replacement? So age alone is not a factor for considering a knee replacement. So patient, even if they are younger than 50 years of age, but they are having severe pain, getting difficulty in walking, climbing staircase, their routine daily activity has been reduced, and on X-ray it shows a severe arthritis, then they will definitely benefit from knee replacement surgery. So age alone is not a factor for knee replacement surgery. My next most important question many patients ask about the robotic knee replacement. So doctor, does this robotic knee replacement perform the surgery all its own? So no. So robot, it just assists the surgeon. The main driving for the surgery is the main surgeon. So it assists the surgeon in planning, in bone cutting, in ligament balancing, in getting the alignment of your knee properly, and in implant fixation. So robotic technology is an advanced AI-induced technology which helps to give a more precision for the patient, and it helps to get a better outcome. So you don't fear about the knee replacement surgeries. So important factor when you're considering for the knee replacement, you should consider all the combined factors. It's not alone your age or pain or severity of the arthritis. It depends on the combination of all these factors which help us to plan your knee replacement procedure. So take home message is that, do I really need a knee replacement? So the answer is no. So one important point. So always don't ignore your knee pain. Just get evaluated, get clinical examined, and on X-ray. So if you are wondering, do I really need a knee replacement? So the answer, it cannot be alone on your pain or on your age or on X-ray. It should be a combined decision on all these clinical factors, on your examination, on your physical activities. So friends, you don't fear about your knee pain. You do consult us at Medicover Hospital. Treat your knee pain, be healthy and be active. Thank you.